Good morning. Welcome to this joint briefing of the Early Childhood Subcommittee of the House Ways and Means Committee and the Education and Economic Development Subcommittee of the Appropriations Committee. Today, we'll be hearing from the Maryland State Department of Education about childcare. And before we get started, I do just want to note that very recently, Comptroller Brooke Lehrman released a comprehensive report on the state of childcare in Maryland, and the results were frankly concerning. Even before the pandemic, we knew that childcare was a key industry in our state that was struggling. But in just the past few years, we've seen a 15% decline in licensed childcare providers, which has resulted in a 5% decline in the overall number of children that could be cared for in licensed care. And meanwhile, our state's childcare workforce has shrunk by about a quarter, which is worse than nearly all other states. And we continue to see major financial struggles for both providers and for families. At this point, it's notable that the cost of licensed care for an infant is significantly more than tuition is at UMD College Park. We know that a high-quality early education not only prepares our youngest learners for kindergarten, but provides a lifetime of benefits. And I'm glad we have this opportunity today to learn more about MSDE's oversight of licensed childcare. And let me turn to Chair Smith for her opening remarks.
Thank you, Madam Chair. I just want to say good morning to both of our subcommittees, as well as to all who are joining us virtually. And thank you to the state leaders that are providing presentations to us today. As Madam Chair eloquently stated, childcare is not only a vital issue of the development of young people, it's also very important for family economic mobility. And often those providing childcare are, quite frankly, the workforce behind the workforce. And so I'm eager to learn ways that we can better support the provision of childcare services and improve quality, affordability, and access. And I thank you, Madam Chair, for your leadership and spearheading this briefing. Thank you very much.
Thank you, Madam Chair. And to my colleagues, I will just note that today we've asked MSDE to focus more specifically on the licensed childcare and not on Pillar 1 of our Blueprint for Maryland's Future that addresses publicly funded pre-K. As you all know, we do have a briefing between the full Appropriations Committee and full Ways and Means Committee next week on the 22nd on all aspects of the Blueprint. So with that, let us introduce our special guests for today. From the State Department of Education, we have from the Office of Teaching and Learning, Dr. Tanette Smith, who's the Interim Deputy State Superintendent, and from the Division of Early Childhood, Dr. Shana Cook, Assistant State Superintendent. And from the Office of Professional Learning and High Quality Instructional Material, Aaron Senior, who's Director of Digital Learning and School Library Media. So I will turn it over to our guests for their presentations.
Thank you. Good morning, Chair Polakovich, Carr, Chair Smith, and Vice Chair Harris. I'm going to get this presentation up and started. I do want to thank all the members of the subcommittee and guests for this opportunity to share information on childcare with all of you. All right. Can everyone see? Okay, perfect. All right, my name, as was stated, is Dr. Shana Cook. I'm the Assistant State Superintendent for the Division of Early Childhood here at the Maryland State Department of Education. Thank you again for the opportunity. Today, I hope to brief you on Maryland's Child Care Scholarship Program, including its current status, challenges, and plans for sustainability. Today, I will cover 5 main topics: the statewide context, the Moore-Miller administration's historic child care budget proposal, an overview of the Child Care Scholarship Program, my apologies, updates to program enrollment, and our proposal to ensure the program's long-term sustainability. Let's start with the statewide context that we are all pretty much familiar with. Maryland faces 2 significant challenges: a structural budget deficit exacerbated by the loss of the pandemic funding and uncertainty around federal policies. This is particularly impactful for childcare, given that a substantial amount of childcare is funded by the federal government. To address these, the Moore-Miller administration is prioritizing families by investing in childcare, education, housing, and healthcare, all aimed at fostering economic growth and strengthening Maryland's labor force. The governor's FY26 budget proposal allocates a historic 568 million in total funds to the Child Care Scholarship Program, with $500 million going directly to child care scholarships. This will support approximately 42,000 children, reflecting an almost 400% increase over FY23 funding. This investment underscores the administration's commitment to affordable, high-quality childcare. As a reminder, the Child Care Scholarship Program helps low and moderate income families access affordable early care and education. It supports children's development and school readiness while enabling parents and their families to go to work or pursue education and training, aligning with the blueprint for Maryland's future. Now I'm going to share with you a short video on the program to help the subcommittee members and the public better understand the intricacies of the program. This video was prepared for private providers and childcare providers all across the state, as well as geared towards families. One of the things we're trying to do better at the Maryland State Department of Education is really focus on communication. And sometimes memos and written communication isn't always the best way to reach people. So one of the things that we're looking into is, and Dr. Wright has led on, is creating more video content to help folks understand the program.
Understanding the Maryland Child Care Scholarship, an overview for child care programs, providers, and families. Welcome to Maryland's Child Care Scholarship Program. Administered by the Maryland State Department of Education, or MSDE, and managed through CCS Central 2, this program helps eligible families pay for high-quality child care while also supporting child care programs. Families qualify for child care scholarships based on income. For example, a family of two can earn up to $61,222 a year, and a family of 12 can earn up to $135,049 a year and qualify for the program. Scholarship amounts vary depending on location, child's age, and type of care, but the goal is always the same: providing equal access to quality care and education for eligible families. MSDE partners with child care programs to ensure payments are made for children enrolled through the scholarship, giving child care programs the financial stability needed to continue offering exceptional care. How the scholarship works. Families select a child care program that participates in Maryland Excels, the state's quality rating system. After choosing a child care program, families request enrollment through the Child Care Scholarship Family Portal. The child care program must accept and confirm their request in their provider portal. Once accepted, the scholarship becomes an agreement between the state, the child care program, and the family. The family pays directly to the child care program any other costs not covered by the scholarship, and sometimes a co-payment has to be paid. Advance payments. To help child care programs receive payments faster and avoid delays, MSDE makes advanced payments before the program submits an invoice. The payment amount a child care program receives from MSDE is based on the number of children they have enrolled in the Child Care Scholarship Program as of the last Saturday of each month. The first payment is processed by MSDE by the 15th, covering services from the 1st to the 14th of the month. The second payment is processed by the last day of the month, covering services from the 15th to the end of that month. After receiving the advance payment, child care programs are required to submit an invoice at the end of each 2-week period for the actual services provided. If the invoiced amount differs from the advance payment, an adjustment will be made 3 months later. If MSDE paid the child care program less than the invoice amount owed, MSDE will pay the difference owed. If MSDE paid the child care program more than the amount owed, MSDE would reduce a future payment to the child care program to make up the difference. Additional adjustments can also occur. For example, adjustments can be made due to attendance differences, closures, unapproved holidays, or if a program is no longer participating in Maryland Excels. Ensuring program integrity. MSDE works hard to ensure that scholarship funds are used appropriately. Families must check and confirm their child's attendance in their family portal account. If there's a difference between the program's attendance records and what the parent confirms, CCS Central 2 will start a program integrity audit. Programs must provide signed attendance records or electronic attendance receipts within 10 business days if requested. Failure to do so will result in the need to repay funds. Looking ahead, MSDE and CCS Central 2 are working to reduce the payment adjustment period from 3 months to 1, making it easier for child care programs to manage their cash flow and continue offering exceptional care. If you would like to learn more about the Child Care Scholarship Program, please visit money4childcare.com. Providers and families can learn more about Maryland Excels by visiting marylandexcels.org. Maryland is committed to ensuring every child has access to quality care and every family receives the support they need to thrive. The Child Care Scholarship Program helps eligible families access high-quality early care.
Oops. All right, so then the video wraps up. I do want to publicly apologize. I meant to play the accessible video. You can find the accessible video on YouTube, on the Maryland State Department of Education's YouTube channel. Now I'm going to transition to talking a little bit about the strengths of the program. Right now, we've successfully implemented presumptive eligibility that allows parents to submit some of the required documents. It's a much less burdensome application, and the scholarship is processed in 3 days or less. Oftentimes, because of our back-end systems, our new family portal and provider portal, sometimes those applications are processed in less than a day. So this has been a very successful initiative of the Maryland General Assembly and the administration. The portal is been very successful. We have both a helpline for families and providers to help them navigate the online portal. We used to have a paper process, and the application could take more than 30 days for a family to hear back on whether they got a scholarship. Now that we've automated a lot of the back-end systems, this is a much, much faster process. These features, in addition to advanced payment, help promote stability of the program and help expand access to quality childcare in our state. However, the program is always working towards continuous improvement. We are working to streamline advanced payments, as stated in the video, strengthen program integrity through audits, and enhance customer service. Additionally, it is important to note that childcare businesses are facing challenging market conditions, such as the rising costs of liability, insurance, and restrictive landlord and HOA policies, which impact not only our childcare supply, but also impact childcare providers' ability to operate. This is a significant burden for the field. Now I'm going to talk to you a little bit about the new rules. So the 2024 Child Care and Development Fund final rule already went into effect, and it requires all states to lower child care costs for families, maintain low copayment rates, and implement prospective or advanced payment for child care providers. Maryland is already meeting many of these requirements, but has requested a waiver for supply building grants due to budget constraints. Further mandates include presumptive eligibility, which I just talked about, we've already implemented, and ensuring that we have a minimum 12-month eligibility period for families, which we've also already implemented. These measures simplify access and ensure continuity of care, and Maryland has already implemented many of the requirements in the new 2024 CCDF rule. Since January 2023, the program participation has grown by 66%. This program is very much needed for the field and for children and families across the state. And that's evident by the amount of growth that we've seen during this administration. We're serving nearly 16,000 additional children from since January 2023. And provider participation in the program has also grown. So more providers have opted into accepting families with the Child Care Scholarship, which has increased the supply of available child care scholarship seats across the state. We've seen an increase of 14%, reflecting our commitment to expanding access and exceeding the national average for child care enrollment. And when we compare ourselves to other states around the country, we're serving many more eligible children in Maryland than other states. Despite these historic investments, fiscal analysis shows a need to pause new enrollments starting in May 2025. This measure is essential to maintain the program's integrity and support the 42,000 children who are enrolled in the program and who will be enrolled in the program. We are proposing that we will transition to a replacement mode to sustain this target enrollment level so that we can ensure that we're managing expenditures within budget cycles. To prioritize families, we propose continuing enrollments until May 2025, then pausing enrollment and backfilling by focusing on the lowest income families and those under the categorical eligibility in COMAR that you see listed on the screen. This approach ensures that the program remains sustainable while addressing Maryland's child care needs. Thank you for your time today. My colleagues, Mr. Krishna Talor, the Deputy State Superintendent for the Office of Finance and Operations, and Dr. Akila Aline, who was introduced earlier, and I are happy to address any questions that you may have about the program or plans for its future.
Thank you, Dr. Cook. And do any of your other colleagues have presentations or anything else to share before we open up to questions from members of either subcommittee?
No.
Okay. I will start with Delegate Miraku North.
Chair, and thank you, Assistant Superintendent Cook, for your work. And just want to take the time to say thank you for always being available to answer our questions and educate us on the work of childcare. As I'm listening to the presentation, I'm hearing all the positive things that the scholarship program is doing, but I admit I instinctively paused when we talked about the pause for this program. Is with the explosive popularity of it, are we seeing cracks in the way things are being done that we have to then pause it to see what's working? Just trying to understand the justification for the pause if things are so wildly successful in these 2 years.
Thank you for the question, Delegate, and do appreciate you always being open to have conversations with the department. We are not pausing the program to think about ways to make it better. One of the things that we're really focused on is ensuring that we're keeping the program within budget during the fiscal year. And what has happened is we are a product of our own success in Maryland. The program is very easy to enter We have presumptive eligibility. Other states are clamoring to ask us how we've implemented that because they're trying to do the same thing. So we're actually a leader that many states are looking towards. Same with advanced payment. One of the challenges that we have is that children and families are enrolling in the program at a very fast clip. And we want to ensure that we're maintaining and staying within the allocated budget during this, difficult context in our state in terms of our overall budget. And so that's something that we're hyper focused on. That's why we're not freezing enrollment. We're pausing. We're going to backfill any slots available and continue to prioritize our lowest income families as well as families who are on TANF, temporary cash assistance, supplemental security income, SSI. So we're prioritizing those families in terms of enrollment, and we're trying to keep this program within budget within the fiscal year.
Madam Chair, is it okay for me to call in a probes question?
Yes, please do. Please do.
Thank you so much. Delegate Solomon.
Thank you, Madam Chair, and thank you for letting me rejoin my beloved colleagues on EED. And Dr. Cook, I just want to say thank you for your service and your whole team. I know Dr. Alina's on here. You all have been just wonderful partners to work with. I know we talk a lot, and we've navigated a lot of really thorny issues together, and just appreciate it. And thank you for recognizing. I mean, I think the success here is a result of an incredible partnership between the General Assembly. I want to recognize the leadership of Speaker Jones, who has made this a top priority. But the successes that we've had are because of the partnership and the legislation that we passed in 2022 on presumptive eligibility, on growing family child care centers, on creating mechanisms for child care centers to access capital dollars, and yeah, we're in some ways a victim of our own success, which is really wonderful. So I want to kind of echo the sentiments of my colleague from Ways and Means around the freeze, and I have a couple of questions, but I do just want to clarify to begin with. Because I know as a result of the legislation that we passed in 2023 around changes to the scholarship program, you all sort of have to affirmatively ask us, the General Assembly, so that there's a legislative session before any changes are made. So the request is around an enrollment freeze. There is not is there a request also to change some of the requirements or the subsidies around the copays, or is it just the freeze?
No, I think the administration, the department are clear on this. We don't want to add any more burdens on families. We want to make sure our program is one of the most generous in the country in terms of its ability to get families access to the scholarship quickly. I mean, actually my uncle was just experiencing this in New York. It took over 30 days to make sure he could get a scholarship for my cousin. So we are definitely a leader in this space, and I don't think we want to backslide in any way. We want to keep the program moving forward. Our goal is to maintain the budget.
Thank you. And I agree. I mean, I think you've just highlighted exactly what our intent was in 2022 to not only make it quick, but the childcare winds up being either the most expensive or second most expensive only to housing for families in the state, and every afford to send their kids to a high quality space so they can work or go to school is really critical. So I guess the question I have for you is, and I mean, at this point, obviously the budget now resides with the General Assembly, and it'll be, our prerogative to make changes. I know your agency obviously does enrollment projections, years out to try to figure out where we're going with things. So while I appreciate what you're talking about with the pause, there will absolutely, undoubtedly, if this goes into effect, be families who will not be able to get access to care, because if we affirmatively choose to make that policy change. Do you have anticipated enrollment in what enrollment projections would have looked like without a pause, the number of families that will potentially be put on a wait list or be denied care at the speed in which we have tried to do it if the pause goes into effect in May?
Yeah, so we're working with a national leader in projections, prenatal to 5 fiscal strategies. They have worked with and are working with many states across the country around childcare projections and shared with the department and others that Maryland is an anomaly in terms of how quickly we are enrolling families month over month. We do have those projections and can share those with the subcommittee.
That would be great. I mean, I will just say any family that cannot go to work because we don't have a childcare slot for them or the ability for them to pay, I think is a hit to our economy. And again, I think we should be celebrating our success that we are, if not the best, one of the best in the country at enrolling students. We should be a national model, and just really grateful again for the work of your team in helping us get to that place, and would hope that we don't run into the situation that we're potentially facing today. Thank you, Madam Chair.
Thank you, Delegate Solomon. Next, turning to Delegate Long.
Thank you. I would like to ask Mrs. Cook, could you possibly give us some statistics, email some statistics to who's actually receiving these scholarships, what income, just some statistics I'd like to take a look at. And please make it simple because I'm not a mathematician by no means. So I appreciate it. Thank you.
Yes, we actually have a bar graph that I cut from this presentation because I thought it was too many slides, but we can send that over to you. It shows the span of ages in the program and how many children of that age are in the program. We also have the breakdown. We used kind of a 10 percentage point interval. We have the breakdown of different socioeconomics who are eligible for the program available as well. So we can send that information to you, Delegate Long, after this meeting.
Okay, and that'll show what the income projections are, income levels are as far as participation and things of that nature.
Yes,
All right,
that's exactly what it will show.
Thank you.
Thank you, Delegate Long. Delegate Ebersol.
Thank you. I have a question, but following up on Delegate Long's question, if that data is broken down beyond income levels, I'm sure you could do it with respect to a number of the protected class groups that we are trying to reach out to. I'm sure you have it, so if you can include that as well, how we're impacting children of color, LGBTQ students, if we know, or ones who are members of families that are LGBTQ, that kind of thing. I don't know if you have any of that or not.
Yeah, I'll have to look into that to see if we collect that type of demographic data. One of the things we try not to do is ask too many questions.
Yes.
Yeah, so
just whatever you have, just don't limit it. I was just saying, don't limit it to just income. If there are lots of other factors, and I'm sure you consider the ones that you can gather. I'm not gonna present you with a menu, but you can present us with yours.
That sounds good.
So we all felt a red flag. We're pausing. First of all, you used a phrase that I want you to elaborate on. We're going to backfill for now. That I want to understand what you're backfilling or who you're backfilling. And second of all, you've said basically the problem is that it's not really a problem with the program. It's a problem with budgetary ability. If you could give us, and I'm sure I'll be putting you on the spot here, but if you could share with the chair, what would be your goal? What would you need from us to not have to pause? Okay. In other words, how deep would we have to reach into our pockets?
So I'll talk about the backfill. So when we say backfill, I think the early childhood field historically, when there's been a freeze, it's been a freeze for a long period of time where no families are able to enter the program. That's not what we're talking about here. We would pause the program until September, and then we would begin to backfill slots so that we can maintain enrollment at 42,000 children, because that's the number of children, plus or minus, that would keep the program within budget within this fiscal year. We would prioritize the children laid out in COMAR. So those are families who are on temporary cash assistance, or SSI or other different groups, vulnerable groups of children and families. And we would also prioritize the lowest income children within that eligibility range for the Child Care Scholarship Program.
Okay.
In terms of giving you a budget number of how much more,
Yeah.
I think it really would depend. There's a lot of factors that go into that determination, which include the level of reimbursement rates for childcare providers. Cost modeling actually is the gold standard, but in Maryland, we're reimbursing based on the market rate survey. And we need to move a little bit closer to cost modeling, which it would be a hefty increase. Like we're talking more than $100 million. Yeah, so this is not a minor change. This is very significant budgetary impact long term.
Thank you. I only ask because I want us to be careful because we're in a budget crunch doesn't mean that we can't prioritize. That's a big number, and I'm glad you said it. I needed to
Yeah.
hear it, but it doesn't mean we can't prioritize the things that are most important to us. In other words, I don't want us just to pitch our towel in on things, and I think the people on these committees would be the people who would be the most committed to this sort of thing. You know, it's like you say, it's probably not a number that's attainable, but we need to ask and we need to think, and so that's all I will add. Thank both doctors for being here. And I also thank both chairs for letting me speak.
Thank you, Delegate Eversole. And colleagues, if other members have questions, please use the raise hand function. Chair Smith, do you have any questions?
Thank you, Madam Chair. Not as much questions. I feel like our members have collectively really tackled much of what I was concerned about, but I just wanted to just echo the sentiments of my colleagues around commending Dr. Cook and her team on navigating a lot of administrative and sometimes technological challenges. With grace, I do believe that you've received the urgency, that you've heard from us, and we know that it's really important for your team to ensure that Maryland young people are getting access to safe, supportive, and adequate childcare. So I just want to commend your team, but I know that there are still other challenges that remain, and we just want you to know that we are open to remain in thought partnership on how we can solve those problems and how we can direct resources as needed. So I think I not only speak for myself and my fellow chair, but for all of us assembled, we want to be in partnership with you because there's not a district represented in this Zoom that does not have young people and families that are desperately looking for affordable, quality childcare and are looking to us to help them navigate that. So once again, thank you, and thank you for laboring with us.
Thank you,
We-
Chair Smith.
I just have to say, we really are thankful for the partnership of the General Assembly as it relates to childcare issues. I think we've maintained open communication, and I think it's really why we're in the situation we are today. We're really serving a very large amount of children and families across the state, and I'm very proud of that and hope to continue.
Yes, very well said, Chair Smith. I'll associate myself with your comments too. I do have a few questions and actually a couple more on scholarships that I don't think we've addressed yet. So the pause that's being requested, is that just for the next fiscal year, or would that be for an indeterminate amount of time?
So right now we're only asking for next fiscal year. We're going to be monitoring the projections versus the actuals very closely month to month. We have this year-long contract with Prenatal 5 Fiscal Strategies, which we're very confident in their work and their projections and methodology with us. And so we'll be monitoring this, and we're hoping to stay in open communication with the General Assembly and other key stakeholders so that they're aware of where we are. And if we're not meeting the projections and we're falling below, then I think that will lead us to a different state. So having that flexibility in the agency's hands to calibrate this in very close partnership with the General Assembly and others would be very helpful in a time like this where we're trying to make sure we're calibrating this right and making sure as many families as possible have access to the program.
Thank you. And I'll say, I've heard, I'm sure my colleagues have heard too, concerns from providers about overpayments and underpayments as part of the program. I know the department has had a lot of communications directly with providers, and I do appreciate that we received a memo leading up to session about a new shorter time frame for that reconciliation period. I believe it's going to be going from 90 days to a 30-day period, and I believe that was supposed to start in this month. So Dr. Cook, if you could just provide an update, has that new 30-day period started? And if not, when will it start?
I'm going to kick this over to Deputy State Superintendent Krishna Talor.
Good morning, Madam Chair, committee members. For the record, my name is Krishna Talur, Deputy State Superintendent for Operations and Finance, and just want to ensure that I'm answering the right question. This is regarding completing the payment adjustments within 30 days.
Correct.
Absolutely. Okay. So as you recall, you may recall that when the advance payment process was implemented back in January of 2023, this was done with the understanding that the technology infrastructure that we have that processes the payment and the necessary true-ups was done on a 20-year-old system. That system has not only reached its technological limits, it has also reached what we could call as its boundaries of design, flexibility, and limitations in adopting to new business changes. So the reason for adopting a 3-month turnaround time at that point was to give agency the time to complete the necessary systematic changes and implement the true-up process accurately. It took us a while to get there, and we knew at the time the need to shorten the time frame. At this time, our contractors, the individuals the company that's responsible for maintaining the system, along with the MSDE resources, have completed the coding of the shortened true-up window. That process was completed in November, December timeframe, and we are in the middle of extensive testing. Our goal was to, and remains to complete this process within the first quarter of this year, but at the earliest. Our hope is that within the next couple of weeks, we will have a better idea of the test outcomes, and it is progressing in the right direction to be able to provide you with a firm deadline or arrival date. Hopefully that's helpful.
Thank you, Dr. Triller. And actually following up on that.
There are only two doctors.
Oh, I'm sorry. I'm sorry.
And Dr. Smith.
Mr. Tiller. And can you also clarify, so the new system, will it accommodate and better address children who are enrolled part-time? Because that's another concern we've heard from providers, where if they have students who are only attending 2 or 3 days a week, how the old system handled those, and that led to some overpayments in some cases.
Right. So there are 2 important initiatives that are going on right now. The system that I refer to, we call it CCATS, the Child Care Administration and Tracking System. This is the almost 25-year-old system, which is currently being somehow adjusted to do the advance payment as well as this true-up process. But at the same time, MSDE is in the middle of a comprehensive upgrade to the entire CCAT system that includes the effective administration of advance payment right from the get-go. And that entire upgrade is expected to go live in January of 2026. And adjusting or addressing the glitches or the issues such as the ones that you mentioned accurately tracking the children enrolled part-time in the program, and how to calculate their payment. All of those things are being addressed as part of the new system upgrade. The work that I just mentioned that is in the pipeline, that the testing is taking place with the next couple of months turnaround time, is holding the existing process in place to ensure that the payments that are going out are as accurate as possible, and we shorten the time frame. The system no longer has the bandwidth, if you will, to do the design changes needed to the foundations of the system to address the issue that you mentioned. So that's another project that Dr. Cook's team, my team, and our consulting partners are working very closely together for a January 2026 rollout.
Thank you. And two other questions. Dr. Cook, if you could speak to funding for the childcare credentialing program, and given that that was, I'll put that on the legislature, that was our mistake this last year, that funding was not mandated and continued through the blueprint. But if you could speak to the future for that program, please.
Absolutely. The administration and MSDE strongly support the restoration of funding for the Child Care Credential Program, recognizing its vital role in supporting early care and in supporting the early care and education workforce with access to subsidized training and professional learning opportunities. While funding for this important program was not addressed in this initial budget proposal, the administration is committed to addressing this oversight through a supplemental appropriations request to ensure the program's continued impact and success. One of the other things that we're focused on is making sure we're aligning all of our different career pathways and just making it make sense for the child care field and the early care and education field. We have lots of different programs that have different qualifications and have different pathways, and our goal is to unify those pathways under one umbrella to make sure that it's easy to navigate a career pathway for as an early childhood teacher. So we are also beginning a work group called a Career Ladder Work Group. The work group, hundreds of providers applied to be a part of this work group, so you can kind of get a sense that many were interested in having this ability to have a conversation about solving this problem of how to navigate a career ladder in early childhood. So we are picking, we're reviewing applications and are using a rubric to choose those work group members. And we will be meeting monthly with the work group and getting their input on how to improve this landscape and support them in development, professional learning, access to opportunities, credentials, degrees at no cost through our child care career and professional development fund. Really ensure that folks know how to navigate all of these programs and utilize the available funding to develop and move up the career ladder.
Thank you. And my last question, I think, is for Dr. Smith. So I'll apologize to my colleagues on the Appropriations Committee, but libraries are also within the jurisdiction of the Early Childhood Subcommittee. And I just wanted to get a bit of an update on MSDE's work in implementing the Freedom to Read Act. I believe that there are regulations that are in the works, and if we could just get a status update there.
Well, good morning to both subcommittee chairs and distinguished subcommittee members. Thank you for this opportunity to provide an update on Maryland's progress for implementing the Freedom to Read Act. This legislation protects students' access to books and diverse educational materials. I'm joined by Aaron Senior, the Director of Digital Learning and School Library Media, with an understanding that the Maryland State Department of Education team members are ensuring that this legislation is implemented in a thoughtful and effective manner across the state of Maryland. To date, MSDE has made significant progress in key areas. One is the COMAR updates. To ensure alignment with the Freedom to Read Act, MSDE has worked closely with the Attorney General's office to update the school library media regulations outlined in COMAR 13A.05.040.01. This effort includes integrating the new legislative requirements and incorporating additional updates to modernize and align current school library media regulations with contemporary educational standards. The updated regulations are being finalized and will be presented to the State Board of Education in March of 2025. We are also supporting local education agencies. This is a top priority for MSDE. This past summer, MSDE convened all LEA school library media supervisors to review the legislation requirements and discuss best practices for implementation. We've provided technical assistance sessions, distributed policy templates, and offered targeted supports through one-on-one consultations to help LEAs to revise their reconsideration policies. Additionally, MSDE collected and reviewed current policies to identify areas for improvement and ensure compliance with the new regulations. Looking ahead, MSD has set a clear deadline for all LEAs to submit their revised reconsideration policies by July 1 of 2025. This timeline ensures adequate time for thoughtful revisions while maintaining momentum towards full implementation. We also recognize the importance of aligning across systems. MSDE continues to work closely with the public libraries offices. This partnership ensures consistency in applying the Freedom to Read Act's principles across Maryland school library media programs, as well as the public library facilities. MSDE remains committed to its supporting LEAs and the public libraries in fulfilling the intent of the Freedom to Read Act, protecting access to a broad range of materials while fostering transparency and respect for community concerns. So thank you again, and I look forward to your questions.
Thank you for that update.
Madam Chair, I wanted to highlight that the state's library system does fall under the budgetary jurisdiction of my subcommittee. So we love to hear from our librarians. Yes. Any other questions? I do see a question from Delegate Solomon.
Oh, you know what? Thank you, Madam Chair. Actually, Madam Chair Carr read my mind. Dr. Cook, I'm glad to hear that the money for the credentialing program is going in the supplemental. I noticed that in the budget that it wasn't there, and obviously that was a really important requirement that we put in HB 1441 last year. So I'm really glad to hear it's coming back. Thank you.
Thank you, Delegate. Back to you, Madam Chair.
Thank you, Madam Chair. Well, I think we have exhausted all of the questions for today. I just want to thank very much our guests from MSDE for being here and providing all of the information. And I'll turn it over to you, Chair Smith, if you have any closing remarks.
I do want to say, for those who don't know, I am a former member of the Ways and Means Committee, so I'm always excited where my former and current homes come together. And so thank you for facilitating this briefing, all the staff members of MSDE, Dr. Cook and team, and also thank you, Madam Chair, for your leadership.
Thank you. I think with that, we are adjourned.